Obviously, as everyone has said, this is this is one of the greatest priorities we should have this session because children's mental health and really population's mental health has been greatly affected over the last 2 years. It created it and also exposed cracks in the system and where people, children and adults, were falling through those cracks, and this exposed a lot of that. So I'm glad to see that we are passing something like this. You know, kids today, I couldn't imagine being in high school today and dealing with a lot of the pressure some of these kids deal with, especially with social media. And I think having these kids at home as long as they were, and I think some of that blame is on the government, did create a lot of problems. I can't imagine dealing with Twitter, Facebook, Snapchat, and all these other things where you're trying to look a certain way, act a certain way, talk a certain way, and then feel like I wonder if somebody's posting about me or I wonder if saying something negative about me, and really not having an avenue to express those inner emotional issues. And I hope that we are able to make inroads in this. Substance abuse has skyrocketed because of depression, anxiety, eating disorders, worrying. It's just sort of a toxic combination of things that have skyrocketed. And we owe it to our kids to do the very best we can to ensure that they're able to recognize these problems early and get the help that they need. I know it's hard to indicate that you may have an issue, whether it's a mental health issue or a substance abuse issue, but I think it's a good message that we're sending to children and really anyone that we are behind you, and we want to do everything we can as a society to make sure you get the help you need. So I support this bill, and I urge my colleagues to do the same. Thank you very much.